collaboration, creativity with respect to setting up and standing up this step-down facility for COVID-19 purposes as we approach what everybody believes will be the surge of patients and the need for additional hospital and step-down capacity here in Massachusetts over the course of the next month or so. I also want to say thank you to the Army National Guard, to the General Keefe, who's behind me here, and to Sam Phillips, who's the head of our MEMA operation, for their work both on this site and their work in collaboration with the City of Boston and the hospitals there on the Boston site. And we continue to talk to and work with the Army Corps and with some of their contractors, Ashcred here and EDS, and others about the possibility of putting up other sites here in the Commonwealth to ensure that we have the capacity that we need to serve people who still need to be attended to but probably don't need to be in a hospital, so that we can maintain the hospital capacity that we need to serve not just people who are dealing with COVID, but also people who are dealing with other medical conditions over the course of the next 5 or 6 weeks. We also, the Lieutenant Governor and I both got an update today on Holyoke Soldiers Home. Val Liptak and the team there have gotten a ton of support from the Guard and from others as they continue to do everything they possibly can to make sure that the people who are there are tested and that the operation is safe. At this point in time, I think all of the residents have been tested, and they are now in the process of making sure that the entire staff gets tested. This process is being led by a mobile testing unit that the Guard put up, which we plan to use around the Commonwealth to test people at nursing homes generally. And I think you'll see this continue to happen over the course of the next couple of months. As I said yesterday, the Holyoke Soldiers Home is a place that the Lieutenant Governor and I and others have visited multiple times over the course of the last few years, and it's always been a joy to be there. It was for the family members who were usually there, talking to them about the way the place was looking after and taking care of their family members was always positive. The conversations and the discussions with many of the residents about their time in the military and their time at the home was, for me anyway, uplifting. I never spent less than an hour there. And I considered it to be one of the best places we had in the Commonwealth for our military families. We hired Mark Pearlstein this morning, who is a former first assistant prosecutor in the U.S. Attorney's Office here in Massachusetts, is currently a partner at McDermott, Will & Emery to conduct an independent investigation with respect to what happened and when it happened, and what didn't happen, and when it didn't happen, and the period leading up to the discovery on Sunday night about what the state of play was there. And we are going to make sure Mark and his team have access to all the services and all the people that they need access to get to the bottom of what took place. And the final thing I just want to say is I want to give a big shout out to Val. She's an incredibly talented and credentialed medical professional. She's done a terrific job as both the Chief Operating Officer and as the CEO at Western Mass Hospital. She stepped into this on several hours' notice, and based on the conversations we've had with her, is really sharp and exactly the right kind of person, with the support of the Guard and others from our administration and from elsewhere, to rewrite the operation there. And with that, I do want to give the Lieutenant Governor, we're in her backyard, she knows all the players here, a chance to say a few words about this setup and the work that's being done in conjunction with UMass to prepare for the surge. Thank you.
Thank you, Governor, and good afternoon, and welcome to my hometown area. I have to say that I'm quite proud that Worcester, Massachusetts, is standing up the first medical field hospital here in our Commonwealth. Let me just start by saying it's hard to believe that a few weeks ago the Governor declared a state of emergency. And it seems, I'm sure for all of you, that a few weeks ago our lives were very different and seemed so far away from where we are today. Like you, I wake up and feel mixed emotions. You know, as a mother, seeing my kids access their online learning, or at least try to do the best they can there. As a mother with my husband, not to see them play their sports and be on the sidelines with friends and enjoying those kinds of activities. Life has changed so much for all of us, and it's right to feel those mixed emotions when you wake up. But I will tell you, and I'm sure the Governor feels the same way, there's one emotion that I feel every single day, and that is the one of feeling inspired by what we see literally in the view of our screens on TV or in social media, or by what the Governor and I see in our work every day. And that's the amazing ability for our first responders and emergency responders to leave their families, to put on gear that they wouldn't normally put on, and to get out there and serve and protect the people of their community and of this Commonwealth. In particular, to see the frontline medical community do amazing work without question, going into rooms with sick patients, literally coming into contact with the part of humanity that is diagnosed with this illness and helping them recover is just really, to all of us, really amazing to see, but I think we all feel very grateful that we have these brave men and women among us doing that work for us every single day. And unfortunately, they'll be at it for a lot longer and certainly deserve our prayers and support. I want to just express how grateful I am to UMass Medical, and in particular, Dr. Eric Dixon. I had a conversation with him at the beginning of this effort, and he said, "LG, don't worry, I got this. This is what I'm made for. I know how to do this. You know, I'm an emergency medicine professional, and I've been here, and I'm ready to take this on." And I was able to listen in to the UMass command meeting that they have every morning. And although I physically wasn't there, I felt an incredible sense of collaboration, professionalism, support to each member of that team to make decisions in the best interest and health of the people that UMass would need to serve. And for them to literally, you know, raise their hand and say, we can set up this bed capacity, which we know we will need because we do not have enough capacity in our ICUs to handle the patients that need the care there and the ones that are stepping out of that care into a less acute need without setting up a field hospital like this. And to see them literally greet the trucks coming in and to unpack this equipment, and it literally medical students graduating online yesterday that will be coming into this facility to care for the individuals in our community is really outstanding, and I couldn't be more proud of the UMass team. I would like to give sort of a call to action on behalf of Dr. Dixon. While this is a physical setup, it doesn't work without the professional people here to staff it. And at full capacity, with 250 beds full, they will need docs and residents and registered nurses and personal care associates to help take care of this population of people. So he's recruiting volunteers to step up and devote their time to help with this effort. You can go online to their website, fill out the application, and be part of the team to help fight back the COVID-19 epidemic here in our Commonwealth. The other group that I'd like to acknowledge is the City of Worcester, because UMass has partnered with the City of Worcester to stand up this facility, to operate it and staff it. And I can't help but think that the city of Worcester is ready for this moment, but they're made for this moment. And it's perhaps because the city has had experience managing through crises in the past. I think many of you think of Worcester and you think of our fire service and how impacted it has been over these past decades. And so they are clearly able to rise to this occasion and to work in partnership with the federal government, with UMass, to set up this facility and to serve. So today, I hope that in the midst of the chaos and the sadness and the disruption that COVID-19 brings to all of us, that you too feel inspired by the amazing men and women who literally are gowning up and gearing up with more protective equipment on the way to help them do their jobs to make people healthier and safer, not only through this crisis, but to be prepared after it, to be ready to get back into the routines and lifestyles that we so appreciate. So thank you. For those of you interested, join the effort if you have the medical training and background, and be available to volunteer and serve. Thank you.